COVID-19 unearthed a lot of things that we learned across the globe in terms of how we deliver healthcare services to individuals. In our case, in the domain of diabetes, it's well known and well published that COVID-19 had a disproportionate effect on those who suffered from diabetes and certainly other chronic conditions like hypertension, heart failure, et cetera. And I think what COVID-19 has done is it's illuminated that we need to bridge the gap between the needs of these people and what they actually have available when they potentially can't see their doctor. And so I think one of the things we learned in COVID-19, we had a sharp rise in engagement for people who were already existing users. They were using features in our product that helped them to manage the relationship with their doctors, for example, sending them the reports more frequently. They engage with food-related features because it's something that we built during COVID times that we actually integrated recipes, integrated meal deliveries, things like that to make it easier. So we were trying to take friction out of the system with the new pressures that were offered and that came with COVID-19 for these people who suffer from diabetes. So at Welldoc, one of the things we have ingrained into the culture of our company and certainly everything we do in our product is how do you leverage artificial intelligence and software as a medical device to offer a new level of personalization and precise coaching that helps patients engage with their own condition in ways that they didn't engage with before, and open that engagement up to not just patients, but to the health ecosystem that surrounds them, their doctors, their pharmacists, their other practitioners. And so it's really this level of personalization that has driven the outcomes, if you would. And what we noticed is that when patients engage with the solution, and that too with the multimodalities of the solution, i.e. their glucose, their food, their meds, their activity, their psychosocial symptomology, when they engage with those different things, both in real time as well as over time, what we've seen is tremendous shifts in hemoglobin A1C. And we had the fortune of working with IBM Watson Health to then quantify the value, the economic impact in the United States. We're seeing about a $3,100 per patient per year cost savings as it relates to somebody using the product for as little as 3 to 6 months. And I think in many ways, people want to do better in their health. I don't think anybody who has diabetes doesn't want to be unwell. They want to be in control of their diabetes. They don't want it to be the other way around. They don't want their diabetes to control them. And so what we found is this is empowering people to take change and to take charge of how they manage their condition going forward and bringing them closer to their healthcare provider because now they have the data that they can share and the provider has the clinical decision support insights to optimize the therapy pathways. Bringing the patient and the provider closer together is something that we've seen as a massive benefit in addition to the economic savings. Yeah, the data is actually pretty alarming, guys. I'll use the United States as an example, but I think it's very similar across the globe. The CDC, which is the Centers for Disease Control in the United States, says that 1 out of every 3 born after the year 2000 will actually develop diabetes. And the principal cause of type 2 diabetes is waist circumference. It's the number one predictor, right? So obesity is a major leading cause for the onset of type 2 diabetes. And we're seeing that number from an age perspective drop. It's well known that in the earlier days, decades ago, people would think that diabetes is a disease associated with those, they're over 65 years old, they're going to get diabetes. But we're seeing that line fall dramatically. Now you have people getting diagnosed in their 20s and 30s, a lot because of their sedentary lifestyle, a lot because of their eating habits, a lot of because of their exercise habits, etc. And so I think digital therapeutics offers an amazing hope. Why? These people use these tools. They use their mobile devices proliferously. They use apps proliferously. If you can use that same mechanism to intersect them for their health in a way that fits into their life, in a way that fits into their workflow, and certainly from a clinician's perspective fits into their workflow, then you actually have a recipe for success. And so I think even though we see these falling ages from a diagnosis perspective, which is alarming in and of itself, digital therapeutics offers great hope to, if you would, at least combat and slow down that curve to the extent that it can. So digital therapeutics in India is actually a complex problem. It's like a string that has many knots in it. So let's try to untangle the knot and let's talk about each knot. First, you have just the prevalence of chronic conditions in India, very high in diabetes, very high in hypertension, very high in heart failure. And today, per the World Health Organization, India doesn't have the right or sufficient number of doctors per capita, to treat these. We heard that in an earlier talk today. And so digital therapeutics offers an opportunity to bridge that gap. It effectively scales the accessibility to a doctor or the accessibility to a group of patients who may be in a rural area that aren't served. For example, you may have a higher concentration of doctors in urban areas. And so in one case, digital therapeutics just has a natural fit with the Indian ecosystem because of its geographic, rural, urban disparities, and also because of the incidence of these conditions. That's kind of number one. Number two, as you look at the rollout of digital therapeutics in a country like India, the government plays a very significant role. And in emergent economies such as India, the government should play one of three roles. In fact, they play all three roles, but they do them in sequence, which is the first role is the government as a catalyst. So the government catalyzes research, innovation, special economic zones to bring the digital ecosystem, software developers, the clinicians, the hospital systems, the electronic medical record companies, all together, pharmaceutical companies, and they create these economic zones for them to collaborate and create holistic solutions that bring together solutions across the healthcare system. So they play a role as a catalyst. Secondly, they play a role as consumer. Why? There's an opportunity to test and pilot these within government employee programs. Could be the Ministry of Health, could be the Ministry of Transportation, could be many of the ministries where the government acts as a consumer. We say this tongue in cheek, it's like eating your own dog food or it's drinking your own champagne. And then of course, once they've created the proof positive and they have these positive case studies, they can then act as a legislator, which is role number three, and say, look, we have the proof that it works. It worked in our population. We're now going to create meaningful legislation that's going to allow these things to be put into the hands of people. And it's going to allow physicians to be remunerated for these types of things to integrate into their healthcare services. So I think in India, in short, the government plays a critical role in terms of how they act as a catalyst, a consumer, and then ultimately as a legislator.